a collaboration between two highly reputed institutions, Ramaiah hospitals in Bengaluru.
Gentlemen, it's indeed a matter of great pride and pleasure that the Honorable all dignitaries are here. It's my privilege to request the dignitaries to kindly come over.
The wishes of our institutions assembled here.
In terms of providing the better life care and also the traditional lighting of the lamp signifies come here all the way from the United States of America to forge this new collaboration, signaling the beginning.
And the Mount Sinai Hospital, New York, coming together. I would like to pause here, briefly reflect the past, the present, and the future. This institution was started in the year 1960 by my beloved father. He established the Gokula Education Foundation. We have celebrated the Diamond Jubilee very recently. The first institution was the Ramaiah Institute of Technology. Then the number of institutions started, and most important milestones were the medical college was started in 1979. The Ramaiah Teaching Hospital was started in the year 1984. The Ramaiah Memorial Hospital was started in 2004. And it became a university. Ramaiah University of Applied Sciences was started in the year 2014. Viksit Bharat. I am confident that will bring enormous benefit to both partners by way of exchange of knowledge and expertise, sharing the advanced medical technologies and strengthening research and development. Friends, it is my belief that this knowledge partnership will usher in great good and of the greater numbers. I thank you all. Let God bless us all. Thank you.
Better, but somehow the clapping was not better. Yeah, the clapping will have to be better than the best, and then only life gets better. Thanks for that response. Well, ladies and gentlemen, Dr. M.R. Jairam, the chairman of the two renowned medical institutes, Ramaiah Memorial Hospital of Bengaluru. Where are the clappings, ladies and gentlemen? And the Mount Sinai Hospital of New York, clapping. There are no COVID restrictions for non-clapping, so please put your hands together in unison. And friends from the exchange of the agreement through the media. So we are sincerely thankful to our friends from the media.
Thank you.
To create something larger than life itself, a calling to create safe, accessible healthcare fueled by learning. That was the spark that birthed MS Ramaiah Medical College in 1979. By 1984, MS Ramaiah created the MS Ramaiah Medical Teaching Hospital, where knowledge met compassion.
Gokula Education Foundation was established in the year 1960 by our beloved father, Sri M.S. Ramaiah. We have just completed the Diamond Jubilee celebration. The mission to deliver education and health for the betterment of mankind was established by the Gokula Education Foundation. Sri M.S. Ramaiah Memorial Hospital, over the years, we have made significant strides in adopting world-class technology and achieving the clinical standards as per with global benchmarks.
Today, the institution is considered a benchmark for medical excellence.
For over 60 years, Gokula Education Foundation has been in the forefront of providing higher education and excellent healthcare to society. We are now focusing on building centers of excellence, encompassing our quaternary care hospital and also expanding our educational institutions into a multidisciplinary university system. I'm sure our collaborations with outside healthcare institutions and universities abroad will benefit our students as well as our faculty.
The Ramaiah Institute of Cardiac Sciences offers heartfelt care, backed by the best specialists and groundbreaking technology. Our cardiologist and cardiac surgery teams operate within our modern cardiac department. The Ramaiah Institute of Oncosciences leverages a multidisciplinary approach with treatment plans that offer better patient outcomes. From medical oncology and surgical oncology to radiation oncology, hemato-oncology and nuclear medicine, we use the latest technology and protocols to ensure higher cure rates, improved quality of life and faster recoveries. When it comes to neurosciences, we tackle the full spectrum of neurological conditions with specialized centers that treat stroke, Parkinson's, movement disorders, spine conditions and brain tumors. Our cutting-edge DBS and epilepsy surgery options offer new hope for patients. The Ramaiah Institute of Gastroenteric Sciences offers a comprehensive suite of services from endoscopy to HPB surgeries and liver transplantation, including a specialized pancreatic care clinic. The Ramaiah Institute of Neuro-Urosciences features a stellar kidney transplant program which boasts high success rates and a dedicated urology team for prostate surgery. The Ramaiah Institute of Orthopedic Sciences team of experts guide you from initial diagnosis to personalized treatment plans and right back to an active life. When it comes to rehabilitation, Ramaiah Memorial Hospital has a state-of-the-art facility and experienced specialists providing a comprehensive set of solutions to ensure you're back in step with life, stronger than ever.
The celebration, the launch of a very important international collaboration that Ramaiah Memorial Hospital is entering into with the famous Mount Sinai Hospital, Mount Sinai International Health System in New York. We have with us Dr. Dorotovics, Sabi Dorotovics, Dr. David Reach, Mr. Gianelli, Dr. Sharma, all of them representing the Mount Sinai International Hospital. Of course, you know our Honorable Chairman, Dr. M.R. Jairam. We will briefly explain to you the contours of the international collaboration that we have entered into. Last year, we began this process of negotiating a collaboration deal with Mount Sinai International. The intention was to see that our Ramaiah Memorial Hospital sets up a number of centers of excellence in various super specialities with the help of a very well-known, highly reputed healthcare system of the Mount Sinai International in New York. We have entered into a 10 years long collaboration with their system, which began on the 1st of July, and we are formally launching the collaboration today. Would you like to say anything? Yes. So the collaboration will involve setting up centers of excellence in various super specialties in our hospital, including cardiology, oncology, nephrourology, neurosciences, gastroenteritis specialty, and transplant medicine. To begin with, we will select a few of these specialties for focus, and as we go on in the process of collaboration, this will extend to the other specialties also. Along with this, we also have agreed that we will co-brand our services. MS Ramaiah Memorial Hospital will perform its services in affiliation with Mount Sinai International. This would mean that Mount Sinai International will help us in maintaining patient safety standards and quality of service throughout the period of collaboration for all the specialties in our Ramaiah Memorial Hospital. This is in addition to their helping us in the selected super specialties for setting up centers of excellence by exchanging their clinical practices, protocols, along with our clinicians in the Ramaiah Memorial Hospital. As you probably know already, Mount Sinai International and Mount Sinai Healthcare System is a very large establishment in New York. They have 8 large hospitals in New York, employing over 7,000 clinicians on their establishment, and they have virtually all the specialties and super specialties for clinical care. They have a history of over 150 years of providing healthcare services in New York, having been established as a hospital in 1852, if I'm right. Dr. Dorotovics will brief you about the history of their institution and their perspective on the collaboration that we have entered into. Dr. Dorotovics.
Pleasure to meet all of you. I would like to start with stating that our leadership at Mount Sinai Health System in New York is very proud and honored to be able to form this long-term partnership with Ramaiah, because Ramaiah and Mount Sinai shares a common mission of finding ways to best serve our patients, provide the best quality care, and strive for the best outcomes. In that quest, we forged this relationship to establish and help improve healthcare processes, clinical care processes in multiple specialties, including cardiovascular care, oncology, and other areas. Our history in New York City is exactly that. We are not only a major healthcare provider in the city, but we are one of the top academic medical centers in New York, in the United States, and in the world. We are providing medical education. We are also doing medical research in virtually all disciplines, and we are in the forefront of innovation, not only in specialty care, but also in quality and patient safety. In that spirit, we are going to work together with Ramaiah and our colleagues at Ramaiah and help them reach higher level of care here as well in Bangalore.
President Swami and all of the people who've welcomed us so warmly here in Bengaluru. It is the first trip for many of us here, and to see this city and to be in this technology capital of India and to be in this medical center which has shown us a true dedication to patient care and absolute alignment of missions is something which is really remarkable. Not only does Mount Sinai have something to offer in terms of helping bring the super subspecialties to the next level, Ramaiah has much to offer us as well. The diversity of the population, the very large nature of the services provided here, the high level of quality that exists, the exposure to patients and problems that don't exist in New York, and the remarkable things that we've seen, such as the tissue banking here in Bengaluru at Ramaiah, are things that will cause information and knowledge to flow in both directions. So we are delighted to be here today. We're delighted to begin this partnership. And I know that we're only talking about the first 10 years of our relationship. I'm sure it's something that will go on for a long time, because when you build friendships like this and partnerships and you train one another, you develop lifelong bonds, and it leads to generations of better care. And we all are here to do what we intend to do, which is to improve healthcare, both in India and in the US. Thank you.
Afternoon to all. It took us about 1 year to get to here after the first meeting back in New York, and I'm very glad that Mount Sinai actually is the first affiliation of Mount Sinai with any medical center in India. So very proud of it. From Jaipur, and I'm working Mount Sinai since 1988. So to see this collaboration, so just to simple terms, of course, besides the quality which will improve, is the both technology and skill improvement. Skill set. What does that mean? Any technology, many equipment, many machines which are available outside and now they're available here in India. Which one to get? What is the best one? Knowing that we have used them, we'll give the right advice. And the second is, you have the machine, but you need the skilled people. So skill, I would say, is the equally important of this affiliation, which will be both ways. One, most important, that experts from here visit Mount Sinai and get trained on those technologies, the new machines which will be coming. So rather than get a learning curve, you start right from the top. Get experience, let's say from my point of view, the valve replacement. So top doctor from here come to Mount Sinai, get a training in 1 month, and then come back and implement that skill procedure. So that is the hallmark of it. In top of it, it will be all education. The residents, fellows, they have the chance to rotate to Mount Sinai. So you can imagine that DM candidate or PG candidate can have 1 month to 1 week rotation and get done what is advanced with their mind, so they get educated to it. So therefore, their thinking process, they are the future of our science, of medicine. So they will have that scope. So combination of these two is best for particularly our Bangalore and Indian public and patients get the best treatment. And that is ultimate the goal of this affiliation is.
I think it's a very interesting. I know many of you are hubbling about what it will benefit, what it will gain. I'm sure this is a new process where we are trying to merge two rich cultures, especially the India practicing affordability and accessibility as a challenge, and there is a resourceful Mount Sinai. They have got quite a few things to know how we manage, but we have a large more things to learn from them on patient safety and the quality. And as you know, across the world, any institution which caters to academic, patient care and research are found to be the leaders in the healthcare. So when you consider these three tenets of the best of institutions, whether you call whatever it is across the world, you need to have all the three branches: academic, curative and research. To that we both have the similar understanding, and to run ethically a very standard care with the patient safety and the quality being the forefront. And luckily, without research and newer things can happen, nothing will move forward in health. For example, when COVID came, we took all the land and took the vaccine as a thing. That protected so many people. Maybe there are controversies, there are issues, but it did protect some people. But the question is, today Indian research needs exclusive partnership with some people who are leading in the research. They are huge leaders in research. Equipments, devices, protocols, algorithms, all that will be shared with us. That's the big advantage as a doctor I am finding for the population of the country, which will be a game changer. I know that all that happens in New York cannot be transported, copy and paste won't happen. What happens there best, we need to customize it to our situation, which they are willing to help us to develop, seeing our thing. The beauty is their people will come here and see in real what is the Indian situation. But leave alone, Dr. Sharma is an Indian and he knows our systems very well, and he has been the star cardiologist over there and he will help the cardiology. Similarly, we have Ash Tiwari, who is a leading uro-oncologist there, who will be leading the oncology driving here. So we are going to get the best of the brains to sit together and work for the patient safety and the patient goal. That's the purpose of this, and the biggest beneficiaries are the doctors on both sides and the medical students. They try to get to see the different part of the world, different systems of the world other than what we teach. That's all. Thank you.
ಇಲ್ಲಿ ಬಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಅನ್ನು ತಗೊಳ್ತಾ ಇದ್ದಾರೆ. ಈ ಹೊತ್ತಿನಲ್ಲಿ ಇಂತಹ ನ್ಯೂಯಾರ್ಕ್ ಸಂಸ್ಥೆ ಜೊತೆ ಕೊಲಾಬರೇಟ್ ಮಾಡ್ಕೊಳ್ಳೋದು ಎಷ್ಟು ಹೆಲ್ಪ್ಫುಲ್ ಆಗುತ್ತೆ?
ಇದು ಯಾವ ರೀತಿ ಹೆಲ್ಪ್ಫುಲ್ ಅಂದರೆ, ಬೆಂಗಳೂರು ಇವತ್ತು ಇಂಟರ್ನ್ಯಾಷನಲ್ ಮಾರ್ಕೆಟಲ್ಲಿ ಖಂಡಿತವಾಗ್ಲೂ ಒಂದು ಜಾಗತಿಕ ಮಟ್ಟದಲ್ಲಿದೆ. ಇದನ್ನು ಹೇಳಬೇಕಂದ್ರೆ ಯಾವಾಗಲೂ ಕೊಲ್ಯಾಬರೇಷನ್ ಅನ್ನೋ ಒಂದು ಸಿಸ್ಟಮ್ ಏನಿದೆ, ನಮ್ಮಲ್ಲಿ ಏನು ಅಧಿಕವಾಗಿ ಕಲಿಬೋದು ಅದನ್ನು ಇನ್ನೊಬ್ಬರಿಂದ ಕಲಿ. ಈ ಕೊಲ್ಯಾಬರೇಷನ್ ಇಸ್ ಅ ಬೈಲ್ಯಾಟ್ರಲ್ ಕೊಲ್ಯಾಬರೇಷನ್. ದೇ ಆರ್ ಆಲ್ಸೋ ವೆರಿ ಓಪನ್ ಟು ಲರ್ನ್ ಫ್ರಮ್ ಅವರ್ ಸೈಡ್. ಯಾವುದೇ ಒಂದು ಹೊಸ ಡ್ರಗ್ ಮಾಡಬೇಕಾದ್ರೆ ಒಂದೇ ಕಮ್ಯುನಿಟಿ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಅದಕ್ಕೆ ಬೇಕಾದಷ್ಟು ಬೇರೆ ಬೇರೆ ಕಮ್ಯುನಿಟಿಯವರು ಪಾರ್ಟಿಸಿಪೇಟ್. ಕ್ಲಿನಿಕಲ್ ಪ್ರೋಟೋಕಾಲ್ ಮಾಡಿದ್ರೆ ಆ ಪ್ರೋಟೋಕಾಲು ಏಷ್ಯನ್ಸ್ಗೆ ಯಾವ ರೀತಿ ಆಗುತ್ತೆ, ಯುರೋಪಿಯನ್ಸ್ಗೆ ಯಾವ ರೀತಿ ಆಗುತ್ತೆ, ಅದನ್ನು ಬೇರೆ ಬೇರೆ ಮಾಡಬೇಕಾಗತ್ತೆ. ಈಗ ಬೆಂಗಳೂರಿನಲ್ಲಿ ಇಲ್ಲದೇ ಇರುವಂಥದ್ದು ಯಾವುದೂ ಇಲ್ಲ, ಎಲ್ಲ ಥರದ್ದು ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆ. ಆದರೆ ಹೊಸ ಥರದ್ದು ಬರೋದಕ್ಕೆ ಒಂದು ಅವಕಾಶ, ಒಂದು ಡೋರ್, ಹೊಸದಾಗಿ ಏನಾದರೂ ಮಾಡೋದಿದ್ರೆ ಜೊತೆಯಲ್ಲಿ ಮಾಡ್ಬೋದು, ಕಲಿಬೋದು ಅನ್ನೋ ಒಂದು ಉದ್ದೇಶದಿಂದ ಇದನ್ನು ಮಾಡ್ತಾ ಇರೋದು. ಯಾಕಂದರೆ ಪೇಷಂಟ್ ಸೇಫ್ಟಿ ಮತ್ತು ಕ್ವಾಲಿಟಿ ಅನ್ನೋದು ನಮ್ಮಲ್ಲಿ ಇನ್ನೂ ತುಂಬ ಬರಬೇಕಾಗಿದೆ. ನಮ್ಮಲ್ಲಿ ಇದುವರೆಗೂ ಯಾರಿಗೂ ಇರ್ಬೋದು, ನಾನು 40 ವರ್ಷ ಇಂಡಿಯನ್ ಮೆಡಿಕಲ್ system. We don't even publish what is the medical errors that has happened in India, how many people have suffered from the medical errors. But that is a true. All of us will know we are all human beings. When we do, there will be some error. But the issue is how do we learn what they have done? Why to reinvent the wheel ಅಂತ? ಯಾಕೆ ಬೇರೆಯವರು ಕಲ್ತಿದ್ದನ್ನ ನಾವು ಸುಲಭವಾಗಿ ಕಲಿಬೋದು, ನಾವು ಯಾಕೆ ತಪ್ಪು ಮಾಡಿ ಕಲಿಬೇಕು ಅನ್ನೋ ಒಂದು ದೃಷ್ಟಿಯಿಂದ ಈ ಕೊಲಾಬ್ರೇಷನ್ ತುಂಬ ಉತ್ತಮ ಆಗುತ್ತೆ. They will share their experiences with us. They will prevent us from doing the same mistakes what they had done previously. That is what we are looking to. Sir.
The key thing is that here in India, you have a huge population. You have a diversity which extends from the DNA to the diseases that people experience, a huge diversity in socioeconomic status. All of that provides data. And when we look at where research is going these days, it is based upon very large data sets. And I've no doubt that in our work with Ramaiah, that we will not only be able to share protocols and share experience and help train some of the specialists, but in return, we will have access and share in the research that we'll be able to do together. And that is something that we hope to make lives better for patients both in India and the US, because we always learn wherever we go. This is not a one-way street. We have so much, it's a very rich culture, a nation wealthy in so many ways, and this is something which is of great value to Mount Sinai to establish this relationship. And there's no doubt in our minds that when we put the data together from India and the US, we will create something that we could not have done separately.
Patients are coming from Africa.
90% of them are
see,
insured.
yes, most of them are coming from Africa now. But you see, it's a question of wherever, see, it's all about economics. If they can afford, anybody can afford, they would like to come and take it. But a center, if it can give, the best of treatment, and that's what it makes people to come in. So from wherever it may be, so they may be able to come. But first of all, let us talk about our own people. So what we are looking at is this collaboration or this hand-holding the area that we have now come to an agreement is the whole of South India and the whole of our Eastern India, starting from Bengal onwards. So they are the two areas that we have taken. So as we improve and as we go on along, we may extend this to other areas also. But basically, because we see from Andhra Pradesh, lots of people are coming to our hospital, especially for super specialties, for cardiology or oncology. There's a tremendous the need for them to come here and take, because they are just our neighbors, close by. So they are able to come, and even from people from nearer places from Tamil Nadu, Hosur and this, they are the people where they would like to come and have it. So we have extended this to whole of South India, and as we go on, and also the people are now, Bangalore has become a center for the eastern region. Most of the people are coming to Bangalore from the whole of Bengal and Assam and of these areas, because it is for them, it is one is they feel that they are secure, the good healthcare system is very good here, and it is affordable. So there are things where now Karnataka has been able to project. So we would like to project that, and if people are going to come from other places, yes, welcome to it.
Sir, with this collaboration, how do you see this artificial intelligence in medicine?
So I guess
Dr. Ray, he will answer that. He's the expert.
So far, I'm about an hour and a half into discussions of artificial intelligence today. One of the things that we have championed at Mount Sinai is building clinical decision support using artificial intelligence to bring the right team to the right patient at the right time. And we like to get away from the word artificial intelligence because that just scares people, and focus more on the concept of augmented intelligence, because we develop algorithms that help our doctors and nurses be more effective in the care, to deliver it more safely. But more importantly, it's very expensive to hire people and train people in medicine, and so you want them to use their skills most effectively. We would want a radiologist who is using artificial intelligence to help diagnose conditions, let's say in mammography or in CT of the chest, and to enable them to, maybe if they were doing 50 examinations in a day or interpreting them, maybe they could do 200, because the artificial intelligence will help them make a presumptive diagnosis, which is confirmed by the doctor, It will help them do the dictation and write-up, which is very time-consuming. And so our hope is that as we are here in the capital of technology in India, that a lot of what we've built in terms of the platforms that support artificial intelligence will be things that we can easily bring here to Ramaiah, and that Ramaiah will be able to be our partners and gain from our know-how. The algorithms that we develop in New York are not going to work in Bangalore, but the know-how that we have and creating the same environment where data are brought together and analyzed in an environment in a city that's very rich in data scientists will enable us to develop locally derived algorithms that specifically will work for this local population. So we are very enthusiastic about artificial intelligence and what it means, and hope that as we work together in this environment, that what we will do is find a way to make healthcare safer, more effective, and also more economical.